Assalamualaikum and good morning. We have to choose CERVICITIS as our group presentation. Firstly, I will introduce my group member. Myself, Muhammad SYA'ARANI bin Muhammad Syafi'i, Sofia Soleha binti Abdul Ghani, and Sharifah binti Ahmad. Now let me explain about the cervix. Cervix is a part of female reproductive system, like what we can see in the diagram, where the position of the cervix in the reproductive system. Cervix position at lower part of uterus. Cervix connect the uterus to the vagina. Cervix also consists of connective tissue and muscles. Cervix divided to two parts, which is endocervical and ectocervical. In endocervical, have glandular cells and squamous cells.
My name is Sofia Soleha, and I would like to present the definition of cervicitis, the etiology, risk factors, and signs and symptoms of cervicitis. Cervicitis is defined as inflammation of the cervix, which is the lower, narrow end of the uterus that opens into the vagina. Cervicitis can be caused by infections or other inflammatory processes such as mechanical trauma or chemical exposure. Example of mechanical trauma is trauma from surgical instruments and the use of foreign bodies such as tampons and IUCD, while chemical exposure comes from the use of latex, vaginal douches, and contraceptive cream. Infection primarily infected columnar epithelial cells of the endocervical glands. The most common clinically significant infectious causes of cervicitis are listed here. Gonorrhea and chlamydia are quite to identify as they can be associated with pelvic inflammatory disease and long-term irreversible adverse effects such as infertility, risk of ectopic pregnancy, and chronic pelvic pain. Patients who have cervicitis may complain of vaginal discharge, bleeding between menstrual period, painful urination, postcoital bleeding, vulvovaginal irritations, and pain during sex. The risk factor of cervicitis. First, cervicitis may occur when the individual engages in high-risk sexual behavior, such as unprotected sex, sex with multiple partners, or sex with someone who engaged in high-risk behavior. Second, it is also can occur when the individual begin having sex at early ages. Third, people who have a history of sexual transmitted infections also have high risk of cervicitis.
Pathogenesis of cervicitis. Usually, patient will get the cervicitis from sexually transmitted infection, STI. The cervix infected by bacteria or virus such as chlamydia, gonorrhea, herpes virus, human papilloma virus, or trichomoniasis. And because the infection will get cervicitis, and the infection will trigger our immune system to respond to the infection, and we can see the immune system reaction. Sometimes we can get the cervicitis from allergic reaction. For the cervicitis, will show some clinical features such as mucopurulent vaginal discharge, erythema, fetichia, and abnormal bleeding.
My name is Sharifah binti Ahmad. I will talk about diagnosis. First, direct microscopy to see the infection of the cervix. We'll see the cervical exudate, which is purulent or mucopurulent or cervical variability. Second, the cervical discharge culture. The sample of the discharge from cervix is taken. The sample will be examined under a microscope and be cultured to check for signs of an infection. We will check for the infection Neisseria gonorrhea, candidiasis or trichomoniasis. Third is bimanual pelvic exam. Bimanual pelvic exam is used to detect abnormalities of the pelvic organ, including the cervix and uterus. Usually, the doctor will insert glove finger into the vagina, and this helps in diagnosis of abnormalities of cervix and vagina. Next is pap smear test. The doctor will take a swab from cell of vagina and cervix to test for abnormalities of the cell. This is one of the screening procedures or diagnostic test for cervical cancer, and also detect the precancerous as well as cancerous cell on the cervix. This is the most popular done test as a part of screening for cervicitis. Next is cervical biopsy. The biopsy specimen is removed with the help of colposcope, and the examination of the biopsy specimen is conducted to detect the abnormalities. This is the picture of the cervix. We can see the strawberry spot due to Trichomonas vaginalis infection, and the next picture is the microscopy of Neisseria gonorrhea in the gram stain smear. For the treatment of cervicitis, we use antimicrobial therapy for bacterial infection. For example, erythromycin, doxycycline, ceftriaxone, metronidazole, depend on the bacteria infected. Erythromycin is used for the chlamydia infection, and ceftriaxone is usually used for Neisseria gonorrhea infection. Metronidazole usually used in Trichomonas vaginalis infection. People under age 25 or who engage in high-risk behavior may be treated with antibiotic even if bacteria are not detected. Next, if the cervicitis is due to irritation from a foreign body or use of certain product treatment, would involve discontinuing use for a short time to allow healing. Is the prevention. First, using a condom every time have sexual intercourse can reduce risk of contracting an sexual transmitted disease. Second, abstaining from sexual intercourse will also protect from cervicitis caused by an sexual transmitted disease. Third, avoiding products containing chemicals such as Dodge and scented tampons can reduce the risk of an allergic reaction. And fourth, the sex partner should be treated also to avoid from the infection.